A dental implant is basically a titanium root replacement. It replaces the root of the tooth that was either lost or is going to be removed. So it's placed where the root used to be. It's going to function like a root. It's going to function like a tooth. It's the closest dental restoration to replacing what you have. So unlike other options, it's going to feel, look, function much more like a healthy tooth versus some of the other options like bridges or dentures. If a tooth is missing, there's going to be short-term consequences and long-term consequences. So obviously, short-term consequences, aesthetics, you can see this missing tooth, so aesthetically it is typically bothersome to a person. Function is diminished, so now you no longer have a tooth to chew with or function with. So those seem to be the short-term concerns that people have. But then long-term, after a tooth is removed, bone starts to go away, teeth start to shift, drift, move, the bite changes. Aesthetically, long-term, those concerns obviously last if the tooth's missing as well. So implants are a fantastic solution to replace teeth. It's predictable, it's a long-term solution. One of the reasons why I get so much joy out of implant dentistry is I know it's a long-term solution. It's not a quick fix, it's not a patch, it's just a fantastic way. And a lot of this is quality of life. You can survive without your teeth, but we enjoy eating, we enjoy socializing, we enjoy smiling. So implants are just a fantastic way to fix this problem long-term. It's a great solution.